a nuclear med study, and I'll get the results in the body of the Epic medical records as soon as it's done. And I can send a patient to Healdsburg emergency room and not hear a peep until medical records from Alliance start soliciting a report from them. I mean, it's just this very strange relationship.
That sounds tricky.
It works. It works in some respects. And Sue told me that they're working something out with the hospital where they're going to somehow do a cooperative vaccination effort. And Alliance is going to be in charge of the lion's share of the vaccine administration, but Healdsburg, since they have an ER, is going to be responsible for handling any of the fallouts that end up with, severe vaccine adverse reactions. So there's a semblance of cooperation. But
that makes sense.
It would be nice. It's not a formal relationship. We can't even park in the doctor's parking spot.
Wow. Oh, and I didn't ask, how did you hear about Encore in the first place? Was it through Jerry? Did you know him before Encore?
We both worked for Kaiser, and we were both chiefs of our department. So we met at the chiefs meeting. But even before that, Jerry had been working at the Vallejo Kaiser. And when I finished my fellowship, I interviewed with him in Vallejo. So, we've been kind of aware of each other for quite a while. And then we got more friendly when we were attending the chiefs meetings together. That was a group of like 12 or 15 people. We got together monthly and had lunch and caucused around regional cardiology issues. And then of course, when we retired, he retired maybe 2 years before I did. And so they have a PCMG retiree luncheon. So we I think the first time we ran into each other at one of those luncheons. When he first retired, he went to, he worked at the county in Martinez for a while. And he was like their medical director. And then I guess he got really disenfranchised and felt like it wasn't what he expected. It was all about billing and cost considerations. So he quit that within less than a year. And then I think he was kind of searching himself for things that, things he could do with his skills and knowledge. And somehow that led him to this interaction with Encore. And then he started searching for physicians who might be interested in positions. And then I was just kind of a natural candidate because we would sit together at some of the luncheons, and he said, "Whoa, are you interested in da-da-da-da-da?" And I said, "Well, yeah, I'm looking for opportunities." And that's kind of how it came up.
Yeah, he was such a great connection for so many people. And it makes me think, I think a lot of people joining the program, they were thinking about, personally, like, how can I still use my skills, thinking about helping patients. What would you say the impact of the program has been on you so far?
The impact of the program? It's been very positive. It's totally, sorry, this boy thinks he's going to get fed. I don't know why he's dinner time. Stop. He's a little wacky. So it's been very positive, and it's definitely found a good fit for me, and I feel like I could very possibly continue working for Alliance for a number of years if, assuming my health holds out and they still want me.
Right.
But so far, I think it's been mutually beneficial because Sue's been very appreciative, and the staff are appreciative and the other providers are appreciative. And it definitely has been a huge, it's been huge for my retirement, because I retired earlier than I had originally wanted to because of some back and orthopedic problems. And I was only 60, and I'm like, God, what am I going to do? Mm-hmm. Because I was still really enjoying working. I was still enjoying clinics and working with patients. And so I was really pretty concerned about what I was going to do in my retirement. And this has fit the bill really well. I don't think, 2 afternoons a week probably wouldn't be enough by itself, but the clinic structure and then the ability, as time has gone on, I've participated more and more in the operations of the clinic, like serving on some committees, and like I read EKGs almost every other day. Even, I can get them electronically, so I just read them and send the report back. And I read ZOs whenever they come in, and I've told all the providers if they want, if they have questions or they need to contact me, to feel free to call me or text me. So that just keeps me engaged. And then I have this other thing I do called Maven, which is a volunteer.
Oh, yeah.
You've probably heard of Maven.
Mm-hmm.
Medical Alumni Volunteer Expertise Network. It's a mouthful.
Oh, I never knew what it stood for.
Yeah. So I started with them even before Alliance because I didn't know about Alliance yet. And at first they weren't very busy, and I was kind of frustrated because I wanted to be busy. But fortunately, things have picked up with them as well. So between those two things, I'm fairly busy. Still not as busy as I was when I was working full time, of course. Mm-hmm. But I think it's made a huge difference between having a pretty fulfilling retirement. And in some respects, honestly, I feel like I'm serving a population I always wanted to, because, I've always had this need to be there for people who are underserved. And like county hospitals, Veterans Administration. And to some extent, I went away from that when I went to Kaiser, because they used to joke about how the Kaiser Marin was kind of like the country club because it's such a affluent county, and all your patients were well-to-do and they were kind of like the worried well. And that's not even really true anymore. As time went on, we started to see a lot more diversity in our patient population. But coming back to a community health clinic, where I'm utilizing my Spanish and working with people who are either underinsured or uninsured, who might not otherwise have decent medical care, it's really kind of, it almost feels like more of my calling than, Kaiser, I liked Kaiser, and I don't regret working there. But when I was at Kaiser, I felt like it was good because I was making enough money to give a lot of it away. Mm-hmm. Mm-hmm. So that was how I was serving my cause. And now I'm doing it a lot more directly. So that's a good feeling.
That's great. I also heard you mention kind of helping out a little bit administratively at the clinic, and I think that's one thing they're exploring with the program, just other ways. Like obviously you're brought in and paid to serve the clinic, and serve patients, but is there, opportunities to mentor other physicians or, lend some of your expertise?
Well, so Sue, that's one of the things that Sue had asked Jerry originally when she was thinking about offering me a position, was whether I would be interested in doing some teaching and, things that were beyond the limit of just working a clinic. And I said, yeah, for sure. I love teaching. And so, when I was there in person, we had like EKG clinics with some of the staff. I did a couple of short talks for the providers, like about statins. And there's been 2 or 3 occasions now where we had community outreach efforts, where like I feel